Idaho Matters is brought to you in part by St. Luke's Pharmacy, now offering free home delivery. For daily medications or one time prescriptions, home delivery is easy to set up. It's convenient and safe. St. Luke's Pharmacy, now delivering to your doorstep. Information on how to get started at stlukesonline.org.
Love Boise State Public Radio podcasts? They are free to enjoy, but not free to produce. If you can give, your support helps keep shows like Idaho Matters and Scandalize available to everyone. Donate now at boisestatepublicradio.org.
More Idaho Matters now from the studios of Boise State Public Radio News. I'm Gemma Gaudette. A good bedside manner can make all the difference for patient recovery, but it is not a skill that every doctor is born with. Dr. Megan Dunay spends a lot of her time helping doctors be better doctors when she isn't helping her patients or acting as medical director of the Idaho State Veterans Home in Boise or as medical director of Keystone Health. During the COVID-19 pandemic, she worked to find ways to give patients in a nursing home setting the antiviral drugs they needed to survive. And she was one of the driving forces behind the educational program known as Project Echo Idaho, which is a series of ongoing physician training courses through the University of Idaho. And it's covered everything from opioids to adult ADHD, menopause to cancer, and quality of life for those with dementia to COVID treatment in nursing homes. The Ada County Medical Society recognized Dr. Dunay with their 2026 Physician of the Year Exemplary Patient Care Award. And when the ACMS asked us if we'd like to talk to her about her work, well, we just couldn't resist. So Dr. Dunay, welcome to the show. Really nice to have you here.
Oh my goodness, Gemma, thank you so much. What an introduction and what a pleasure to be here.
Well, we are delighted to talk with you. Could we begin? How did you decide you wanted to really focus on geriatric medicine?
So I grew up in Appalachia in a college town, surrounded by college kids. And it was a really unique environment. And despite that, I found myself most sort of attracted to and connected to the older adults in the community. Through things like volunteering. I remember volunteering at this little thrift shop as sort of an early high school student. And it was me and a couple of self-proclaimed little old ladies. We would sit around in the back and sort all the donations. And that was actually incredibly formative. And then, of course, my family. I was really close with my grandparents growing up. They were really instrumental in sort of helping raise me. And so they have been absolute inspirations in pursuing geriatrics.
And as I mentioned, you're the medical director of the Idaho State Veterans Home in Boise. What does a typical day for you look like in that environment?
Yeah, good question. So I would say that at this point in my career, I spend probably about 60% of my time in outpatient clinical settings, just doctor's offices, seeing patients here. And then I do spend probably about 40% of the rest of the time in long-term care environments. And the Idaho State Veterans Home in particular is just an incredible place with just absolutely incredible residents, veterans, and staff. And so the physical plan is under construction. You can see it. We have a crane. The crane is called AmeriCrane. It was named by one of the residents, one of the elderly gentlemen who lives at the nursing home. So it's the physical plan is under construction. And despite that, the community of care in that building is just phenomenal. So when I go into the building, to provide care to those patients, it's certainly an interdisciplinary team experience. We get to work closely with my physician assistant, who's wonderful, nursing staff there, social work staff, pharmacy staff, make rounds, visit with veterans at the bedside, just sort of participate in the milieu. And it's just such a lovely, grounding experience. It just really kind of brings you back to earth a little bit.
And so on top of all of that, you also mentor other doctors. Can you talk to us a little bit about that and why it's so important? And I believe, a lot of times you mentor them around cases involving dementia or end of life care.
Yeah, it is such a privilege to get to work with trainees and And I get to work with medical students through the University of Washington programs during their internal medicine rotations often, and sometimes during elective time. I get to work with family medicine residents and even sometimes geriatric medicine fellows. And I will say that having trainees in clinical spaces is unbelievably joyful, right? Patient
Hmm.
encounters are not always easy by any means. Every encounter with a patient is not joyful, but my gosh, having people who are eager to learn, who are watching you, right? Who are holding you accountable for knowledge base and professionalism and behavior, and then engaging with your patients, right? Like seeing students or residents learn how to interact with patients in real time. It's just there's nothing like it. So I'm incredibly grateful for that opportunity. I love teaching.
I want to talk now about COVID and the COVID pandemic, and let's go back to the height of the
Mhm,
pandemic if we could, because you were
mhm.
instrumental in treating patients and finding new ways to treat these patients. In particular, as I said, in a nursing home setting. Can you talk to us about what that was like and what you were doing to ensure, the safety and the health of these patients?
Oh my goodness. Well, thank you for such a generous acknowledgement. I was just part of teams, right? Part of many teams. But I think the thing that I'm most proud of is at the Idaho State Veterans Home in July of 2020. We started to really prepare and ramp up and experienced our first sort of wave of COVID outbreak later October and November. But part of what we did to ramp up during that summer and sort of to prepare for incident cases was to partner with the Boise VA hospital. I had a wonderful colleague, Dr. Sarah McLean. She's an infectious disease pharmacist who has since moved on, but she was just a tremendous asset over there. And she and I partnered to actually get IV medication, so remdesivir, into the nursing home space, right, which was not happening
Hmm.
elsewhere outside of our setting because that we were learning as we went. So it was really, really unbelievable to see not just Dr. McLean and the infectious disease team rally, but nurses from the VA, nurses from the Idaho State Veterans Home collaborated to make a protocol, health information management at the nursing home. Created data management solutions, and basically we were able to identify patients with COVID, identify factors that would help them successfully receive IV antiviral medications and get the drug to them ASAP as soon as they were diagnosed. And it was a massive team effort. I mean, every level, CNAs, housekeeping, everybody was involved. And it was just really wonderful because we ended up actually being able to publish a study about our results. And we learned that if you get IV remdesivir or an antiviral into the body of a patient within 48 hours in that skilled nursing environment, within 48 hours of a diagnosis of COVID, there was a 17-fold increased likelihood of survival. So we were able to
Wow.
publish that in one of the journals of infectious diseases, and that was really just so humbling, and it was really cool to be part of that.
What lessons did you take away from COVID that you are still implementing today?
Yeah. Um, I think that the most important things that I learned from COVID are, I think, around two things that have really stuck with me. And I think of them as, first of all, centering service. So, thinking, how do you remain in service to people with healthy boundaries, without burnout, without martyrdom?
Mm,
So, right, service as a way to find yourself, not a way to martyr or lose yourself. And I saw that modeled, by members of my team, by people that I respected, and so I think that stuck with me. And then I think the other part is this notion of sort of remaining in relationship with people. So unbelievably polarizing times that we're living in, of course, and much of that
hmm.
started during the pandemic and around medications and masking and immunizations. And so the challenge then and now was to remain in relationship with people of differing backgrounds, different opinions, because there's just a richness there, right? You can disagree, but at the end of the day, we have so much more in common than we do um, different. So I think that
Hmm.
centering service in a way that's sustainable, and then remaining in relationship, even when it's hard, and understanding that there's good that can come of that relationship. I think those are two things that have really kind of traveled with me.
I want to turn now to Project Echo Idaho. Can you tell us exactly what that is?
Yeah, and definitely, definitely double check me, all of you Echo folks out there. But essentially, it's a hub and spoke model that developed, several decades ago, actually, to use an expert sort of panel to teach virtually. This was in the era before Zoom when it was developed. To virtually teach about topics that required sort of very specialized expertise. So historically, Echo started, I want to say, in New Mexico, and it was kind of an academic and sort of government partnership where they, for example, in that case, had experts in infectious diseases who educated people about hepatitis C. So that got translated, and it's been around in the University of Idaho ecosystem for a while. But during COVID, and especially as there was such a boom in like the Zoom, um, you know, universe, it got translated into, sort of a convening of, I hesitate to say experts because we were all learning just as fast as we could. But it was a convening of a panel of experts. So I was fortunate to be a part of that. But we had pharmacy, we had, pulmonary critical care doctors, we had infectious
Hmm.
diseases, and what we did was we would meet, twice a week at first, and just on a Zoom meeting, open it up to, the general provider healthcare audience, and present sort of a brief didactic, just like, hey, here's what we know right this second about how we, prescribe or dose X, Y, or Z medication, or here's what we know about infection prevention or infection control, and then sort of field cases. And it was a real interdisciplinary way to sort of in real time respond to the specific questions and cases of our colleagues throughout the state of Idaho. And we kept doing it. We kept doing it for a couple of years. And I think it was just, for me, it was such a touchstone, right? I kept coming back to it week after week. And it was just good to be around that same panel of experts. It was good to be in community, right? It was good to, again, center service and remain in relationship. But it was a place, I think, that folks could go for sort of not just a reliable source of information, but for some relief and community.
Mm. You care a lot for patients who suffer with dementia, and you also do a lot of work, as we mentioned, with end of life care. I- is that difficult? I mean, how hard is this kind of work for doctors? I mean, as you mentioned, putting those healthy boundaries around yourself, right? But I would think that this can also be, difficult, but at the same time, highly rewarding work.
Yeah, and that's such a generous framing of that. Thank you. Yeah, I think it's one of those things where, vocational discernment, right? Your greatest
Hmm.
gifts meet the world's greatest needs. And for whatever reason, I think those of us who end up in this space, have a certain sort of disposition or calling, for lack of a better word, to be here. But yeah, it is, there can be a lot of pain, right? There's loss and there's pain, and bearing witness, right, to other people's suffering, to people's sort of existential questions and journeys. It's a privilege, absolutely, but it is also, it can be pretty painful. And so I think that that's where, again, boundaries, right, self-care, unbelievable communities of family and friends, the medical community sort of writ large, just those types of supports. And then also, I would just continue to emphasize that this isn't care that we provide in isolation, right? This is always a team sport. Palliative care, hospice, we're talking about teams of nurses, nurses' aides, pharmacists, physicians, chaplains, social workers. and the list goes on. And so you're never alone in this. At least I have had the good fortune and privilege of not doing this alone. So I think that's really helpful.
So this might be a silly question, but when should someone start looking for a geriatrician for someone who does work with older patients?
That's not a silly question at all. So yeah, geriatrics is a pretty old specialty, pun intended. But it, I think, suffers from a bit of an image problem because we oftentimes present ourselves as either or both primary care providers for older adults, 65 years old and older, or consultants, right? People to whom patients are referred for questions of geriatric syndrome assessment. So, for example, my patient has cognitive impairment. Meg Dunay, will you see them to figure out if it's dementia or not? And I think that that's part of the issue with geriatrics is it's a little ambiguous, right? Some of us take care of patients in primary care and focus, like I said, on folks 65 years old and older. Some of us do consultative work, like the St. Alice Geriatrics Group does a wonderful job with geriatric consultative medicine. And so it is a little bit of a question, but I would say if you or a loved one are experiencing anything that you would characterize as a geriatric syndrome, so meaning a constellation of signs and symptoms that are usually attributed to physiologic changes or pathologic changes that occur with aging. So, for example, dementia, right? Cognitive changes, cognitive decline, but also things like falls or frailty, osteoporosis or bone health issues, skin failure, wounds, right? Things where there are symptoms that sort of demonstrate a consistent pattern that are formulated or characterized as geriatric syndrome. So anytime that's the case, certainly those are the waters that we sort of swim in. But yeah, if we cross your mind, come on down. I think geriatricians are pretty open to whoever may think they need us.
Well, I want to thank you so much for a lovely conversation. Thank you for spending some time with us today. Really appreciate it.
Oh my goodness. Thanks so much for having me. And thanks for what you guys do.
Oh, you are more than welcome. We've been speaking with Dr. Megan Dunay. She is the medical director of the Idaho State Veterans Home in Boise and the medical director of Keystone Health. The Ada County Medical Society recognized her with the 2026 Physician of the Year Exemplary Patient Care Award. You've been listening to the Idaho Matters podcast from Boise State Public Radio. To stay in touch, you can find quick Idaho daily news every morning when you subscribe to the Connector podcast. And text this podcast to a friend. It's how podcasts grow. Hi, Idaho Matters podcast listeners. If you're on your smartphone right now, or if you have it nearby, I wanted to pop in to tell you about something to check out. Boise State Public Radio is now on Nextdoor. Here's what that means. Trusted local news, thoughtful reporting, and stories from across Idaho right along your neighborhood updates. If you already have the Nextdoor app, you're halfway there. Just search Boise State Public Radio and hit follow.